Thank you, Madam Chair, and I too want to thank all of you for your service to our nation's veterans. We appreciate it very, very much. Dr. Hunter, I appreciate that in your testimony you highlighted the importance of military cultural competency and training. Can you expand on why VA providers are so uniquely positioned to care for veterans and what it means for your members that their providers understand their unique needs?
Thank you so much. VA providers are required to undergo extensive training on military cultural competency. This includes things like multiple compound exposures, whether it is toxins, the interaction between mental and physical health care, as well as emerging research on some of our technologies. Additionally, VA providers, some of which are actually cleared to be able to access classified medical records, and so they can understand environmental exposures that were there. For myself, this was life-saving. At a regular routine optometry appointment that I had where I was experiencing vision changes, and I thought it was because maybe I was just over the age of 40, my VA optometrist was able to connect symptoms I was experiencing to exposures from my service time and get me screened for ocular melanoma. Turned out I had it. We caught it super early at this case, but in every single community care optometry appointment I had, not once had I been asked about my time in military service, where might I have been, the type of exposures that I would have seen. And if we look at the post 9/11 generation and we look at what was found in the PACT Act, the ideas of presumptive connections for things like toxic exposures, but we're seeing more and more aviation equipment, time around fueling, as well as the compound traumas with military sexual trauma and PTSD, it is essential that our veterans are seen by providers who understand that. And in the community, while the Mission Act says they should have training, we actually have no idea what sort of training they're getting. We don't have oversight on that in a real and meaningful way, the way we do have oversight on the types of training that VA providers have.
Thank you for that. And I think in reading Dr. Mobb's testimony, she cited a RAND article stating that, or at least making the assertion that VA providers aren't trained. I know that you've previously worked at RAND. Are you familiar with this article at all?
Yes, I was one of the contributing authors to that study.
Is that true, what the conclusion of that article said?
No, the article said that we are aware of the training that VA providers received. We do not have oversight on the training that community care providers received.
Thank you for that. And another thing I appreciate about your testimony was that you included extensive citations throughout to articles in academic journals, to studies from nonpartisan entities like RAND, GAO, and the CBO. One thing that worries me about the way legislation sometimes comes together is that it is informed by anecdotes and the experiences of perhaps vocal minority voice, rather than by the true evidence. So what does the evidence say about where veterans prefer to receive their care and where the quality and outcomes are better?
The preponderance of the evidence shows that veterans prefer VA care. And when we look at some of the very, very tragic stories that we see and the anecdotes that we hear, we need to take every single one of them seriously and look into what has happened. And the VA does have significant measures to actually address providers that provide subpar care. But we also need to be reminded, as I was often in my doctoral studies, that the plural of anecdote isn't data. And if we look at the preponderance of the data lead us to VA care providing better care. And in surveys of our own members, only 14% expressed any confidence in community care being able to address and coordinate their complex medical needs.
Thanks for that. And, do you have any suggestions on really how we help veterans, the public for that matter, to better understand the evidence and overcome this perception that the VA care isn't as good as community care?
I think it is very incumbent upon VSOs to take an educating role on what the VA is, and also incumbent on members of Congress to continue to engage with VA providers to ensure that we have appropriate oversight and engagement to understand the quality of care that exists.
Thank you for that. I yield back.